Hi, ladies. Welcome to our chat. Hi, ladies. Welcome to our chat and gents too. Um, we would like to thank you for this opportunity to be able to host this peer education session. It is an honor and a pleasure always to share the knowledge and the journey and experience. My name is Wendy Mbhele. I am from 4IR Care. What we do at 4IR Care is form communities that help support one another through our health journey and health choices. So, what we do is coordinate relationships with healthcare workers and you as a patient or just someone who really wants to make better decisions for your health, for yourself, and your family. So, as 4IR Care, we we enable using technology these relationships to be coordinated virtually, but we also offer practical solutions and information through our network of doctors dealing with professionals. When you have questions that you cannot answer for yourself, these are the relationships that we offer to individuals. Our special one that we are most excited about is the concierge care that enables you to partner with a healthcare provider to basically take you through your health journey. If you are taking treatment or medication, they come alongside you and just assist you to be able to answer all the questions that you may have and address all the fears that may come about. But yeah, so this was just a brief introduction while we were waiting for everyone to connect with us. This week, we are talking and rounding off our breast cancer awareness campaigns. We have been on a trail talking to different women and different people with different fears about breast cancer and how it affects them and how it impacts them as families. And that started me thinking on how it would affect me if any of my family members, especially the women in my family, were to be affected. So when I looked at my relationships with the ladies in my life, I am connected to 11 women, and this is 11 ways that breast cancer could be a part of my journey and my life. And so we decided to think around what can we do as a health company and in relationship with doctors and pharmacists and different individuals that want to help us know more about our health and the different precautions that we can take that will help enable us to make better informed decisions and also make choices that are healthy for us in preventing some of the illnesses that we can avoid. So, breast cancer being one of the most serious illnesses that affect women, most serious cancers that takes a lot of women at any age from their loved ones is one of those that we felt we wanted to address. Just sharing basics around what can you do to prevent breast cancer, if there's any kind of controls that you can practice on your side, and also looking at the health risk factors. What exacerbates your chances of getting breast cancer as a woman? And what age should you be concerned or worried about the impact of breast cancer in your life? So, in this journey, by profession, I am not a doctor, but I am blessed to have partners that are doctors and medical professionals who do help with all the information in the background. If you need to consult with them one on one and they look at your personal history and they examine you on individual basis, I feel that is very important to emphasize that I am a I could be a patient, but in this regard, I choose to be a peer educator. I educate myself on different illnesses so that I can share whatever information and knowledge that the people that I have the privilege of doing life with and having access to share with me. So, 4IRK is about connecting you to these relationships. We've built a network of individuals that come alongside you as your health advocates that help you navigate the different scenarios that you might find yourself navigating in real life. So, one of the things that I just want to kind of emphasize that right now with COVID-19 and other pandemics that we've had to navigate as women, the impact has been most felt and most devastating for women and their children and the people that they rely on, whether economically or for caregiving purposes. So it is very important for us as women to one, educate and inform ourselves so we can make choices and decisions to protect our health and educate the people that then rely on us for this information. And secondly, we are still dealing with the aftermath of the HIV and AIDS pandemic when it took out a lot of young women, a lot of young mothers. And in the midst of that, we are now dealing with the coronavirus, which is also devastating communities. And there's very little that we can do from a protection of everyone involved as people. But what we can do is take personal responsibility for the people we love and ourselves. And this comes in the form of one, seeking to inform yourself, educating yourself as much as you can. And once you have that information, you can make informed decisions and choices and at least be enabled to protect yourself and your loved ones. And secondly, is to, once you have this information, is to emphasize prevention. For most illnesses, prevention is the better cure because there is no one solution once you have been affected or infected or you are sick that you can do to make yourself feel better. So prevention is the best form of protection and prevention that we can use. And this enables us to be able to protect our loved ones. So this information is information that we share with our members and our community in the healthcare and also just parents who are interested in learning more and establishing personal history for their families and their children. So they know if I get sick, my children can look out for this and that illness. My daughters can get tested for breast cancer at an early age, so they know what to do. So the whole point of us as for IRK is to enable this environment to be able to facilitate it for you and for your benefit and the people that you love who you want to share this information. So in looking at some of the risk factors that I just wanted to communicate today and just maybe have some girl talk in terms of what should we be doing from a non-doctor perspective as an individual, as a mother, as an aunt, as a sister-in-law. I have so many women in my life, 11 to be exact. This includes my mother-in-law and my nieces and my sisters-in-law. So these 11 women, I am taking responsibility to educate myself for the benefit of all of us, so that whatever we can avoid and know about breast cancer, we discuss it, we talk about it, we make it normal, we make it easy. So the next generation of women in my family and outside my immediate circle can find these conversations easy to have. So one of the questions that we will deal with a lot is, what can I do to avoid breast cancer? And the answer to that question is, look, there are prevention measures, but for the mere fact that you are born female, you are at risk. So that's risk factor number one. Being born female with breast and breast tissue puts you at high risk. So, but don't despair. This is not a death sentence. There are doctors and people who are skilled and knowledgeable to guide you through that process. Once you have identified yourself as high risk, they will examine you, they will personalize the care that you would need for the next steps that you would need for that relationship. So being female is one of the things that I just want you to be aware of. Let's not be complacent and think because I don't have it in my family, we've never had it, that you might not never get it. So the important thing is just for the mere fact you are female, you are high risk, so you need to be cautious and take any measures that you can outside everything that's within your control. What's outside your control, you cannot do anything about. Number two is increasing in age. As we get older, the risk of getting breast cancer increases. So again, doctors will do a personalized examination for you and guide you through that process based on your personal history and your risk factors. But age also plays a role. And then, like I mentioned, personal history. If you've had breast cancer before, most women report that it does return. So it is very, very important that you take all the precautions that you can. And then the other one is in our genetics. So this is unfortunately something that we cannot control. Our genetics is something that we are born with from the mother side and the father side that basically just informs what type of gene pool we end up with. So if there is history in either side of your family members, you might find yourself at high risk of catching, of sorry, not catching, it's not something that you catch. You might find yourself a high risk person for breast cancer. And then the other one is obesity. Women are at high risk if they are excessively overweight. And we know that this is something that we can change with few healthier lifestyle choices and eating healthy and adopting a more active lifestyle. We can mitigate this one factor. And also, one that you might not be able to do anything about is how early your period begins. So the earlier, specifically before the age of 12 years old, if your periods comes in very early, you tend to also be a high risk for breast cancer. And also the last one that I want to kind of mention is excessive alcohol intake. So people who tend to overdrink or abuse alcohol put themselves in a position where they compromise their health, not just for breast cancer, but in many different ways. But because today we're just going through the risk factors that are associated with breast cancer, this is one that I just wanted to mention as well, that alcohol can play a role in increasing your risk factor as a woman. Age-wise, I think it's very important that we become aware of our health risks so we can make decisions based on knowing ourselves and what our genes possibly expose us to in terms of illnesses. But doctors and nurses in our team are able to guide you with these conversations and offer you this information. And this is why we felt as for our care that it's important to form a community that's more educational and preventative when it comes to certain illnesses, especially living through this pandemic with coronavirus, not being sure how to look for help now on different illnesses and people defaulting on some of their treatments because they fear being exposed to more sicknesses when they go seeking for help in public hospitals or waiting in long queues in waiting rooms for doctors' visits. So it is important that you inform yourself and belong to a community and a network of people that will encourage you on your curiosity journey to discover a little bit more about your health needs and your health challenges so that you can pursue your healthier lifestyle. And if you are generally a healthy person, it's important that you maintain that for as long as you can, especially when we are living in unprecedented times of health challenges, one after the other, that also includes our mental health that gets challenged just by the threat of a new disease, a new virus, where our senses go into overdrive and we fear the worst. So it is very important that you stay informed and you stay connected to information, but don't Google your symptoms. Rather, speak to a professional, seek a doctor's advice who will treat you as the individual that you are instead of Googling results that will come with no peace of mind and just stress you out. So let's just quickly chat around some of the prevention measures that we can do to help ourselves and our loved one and the ladies in our lives, whether it's through work and church, wherever you do life and where your sisterhood comes from. It's very important that we exercise the sharing of information especially when it comes to healthcare and preventing illnesses. So, step number one, the very first important thing is always ask your doctor, consult with them, ask them when you should be starting with your health screenings for breast cancer. And number two, you can become familiar with your breast through self exams, and this just basically means you get to know your breast, play with the girls, and just check them out. You will notice these differences when they do come because you're familiar with the shape, the color, every texture that you feel when you do your breast exams. So it'll be easier for you to pick up when something is different, when something feels wrong, when something feels weird, or you experience a little bit of pain. So get familiar with them, do your self exams, and it's easy for you once you notice something wrong to immediately speak to your doctor and ask for advice or go in for a consultation, and they can do what needs to be done. If mammogram is required, then they'll put in place plans for you to get all of that assistance that you would be needing, right? And number three, is reducing or stopping alcohol intakes altogether. If you can, where possible, there's great benefits to not drinking. So, not drinking, and if you are a high risk for breast cancer, it will help you in your journey to reduce the risk of breast cancer and prevent where possible. So it is important that whatever your personal scenario is, you seek the advice of the doctor and you know where you lie in the risk pool, and then you can take the steps to reduce your own risk for breast cancer. And number four is exercise. Adding exercise and being active for the most part of the week. If you can do the 6 days, do the 6 days, or even 30 minutes 3 times a week. Just being active helps to keep your hormones in balance. It helps to help your body recover and get healthier. So it has benefits beyond just fighting cancer, but it also has benefits right across your whole body for the benefit of your health. So it is very, very important to have a healthy lifestyle. And then the fourth one is maintaining a healthy body weight. So maintaining a healthy body weight doesn't mean you have to be stick thin. It just means you have to be healthy and also do your checks regularly. See your doctor. Make sure that all your numbers are looking good. Make sure that everything from a doctor's perspective has been checked or screened on regular basis, especially as you get older and your age and your different lifestyle impacts on your health. It is very, very important that you do these things. Helps you to manage some of the risks that you might find yourself facing due to the fact that you are woman or you are predisposed because of your family history, or just because you've had history with breast cancer before. It is very, very important that we start talking and having conversations with our families, our immediate circles around these preventative measures and these high risk factors and what we can do either as a collective in our little community, my sisters and your friends. You get together, decide that you're going to be health champions for one another, or join our community and we speak to one another about different topics of healthcare that affects women specifically. But we are in community with men and women and practitioners as well that can help you navigate all of the different challenges, because it can be daunting to take treatment for different things or do a journey of chemo on your own without fully understanding what the journey looks like, or without the information of past survivors or doctors who've seen patients recover and get well. So our community at 4IRK is that kind of community that advocates for education, advocates for prevention, so that you can live your life and live it well. So when you YOLO, you're YOLOing at your best, and you are living the best life that's informed, that is preventative versus reactional of different illnesses when you have already been diagnosed with an illness. So this is what we do as a team, and we look after one another, and we look after our community and clients, and also the network of professionals in the background that keep us informed, that educate us, so we can be able to share this information with you and your community and your sisters in your life. So please connect with us. We are on Facebook. We are on www.4irk.co.za, and you can get us on info@4irk.co.za. We are also on WhatsApp. If you go to our website, you'll get the details to our WhatsApp. We do our WhatsApp chats, and on the other end of that, it would either be a doctor or a nurse who is just waiting to hear what your concerns are and ready to do a journey with you, a personal journey with you on healthcare. And this month being a round of breast cancer awareness month, we know that we are dealing with a lot of illnesses right now and challenges, and people can be fatigued with information overload and feel despondent, which is why we are a community that does a journey with you, with our concierge care, our health advocates who come alongside you and do a personalized journey for you and your family. We record your personal information, create this record that you start referring back to, so that when years you forgot what was I diagnosed with, why was I sick, this record will remind you this is what you've dealt with, and this were the treatments that you were successfully on and you came off. So this information helps the next generation, whether it's your daughter or even your mother. You inform them of, this is what I've dealt with in my health journey. So let's see if it's genetic or it's just one of those things that happens because we are human. So let's not let healthcare be challenging and daunting. Let's simplify it for ourselves. We are blessed with a number of professionals who are willing and able to connect with us on platforms such as this or on Zoom to help you navigate the most scary parts of trying to be healthy and trying to avoid, especially illnesses that just come for you just because you are a woman. I feel like we should be so informed that we don't let breast cancer be one of those things that keeps us down when we have so many to deal with. We are game changers, history makers, we are queens, we are raising generations. So, whatever we can avoid when it comes to sickness, let's get together, come alongside one another, and work our journey to healing and strengthening our immune systems and living healthier lifestyles, so that when we go slay those dragons and game changing and breaking those glass ceilings, we do it at our best. We are the healthiest, we are the most beautiful, and we are the most relaxed. So yeah, that's all I have to share today. I want to thank you again for giving me your time and this opportunity to introduce what we do as 4IRK. Like I said, we are a community that wants to see every South African thrive health-wise. We want you to have access to affordable healthcare and innovative healthcare that helps you navigate the most difficult conversations with family or with your partner around healthcare. It becomes a more collaborative effort versus let's first wait until things get worse and then go see a doctor. After we get well, we're like, bye, I don't need you anymore. So we want to change that perspective. We want a healthy lifestyle to be an easy thing, a daily thing, and a family thing, a community thing. And that way we can afford healthcare just because we do it together and not as individuals, but as a team, from a patient perspective, from a doctor perspective, and all the necessary individuals that will give you the best care in a very challenged world health wise, and also in a very challenging time in our lives in terms of the different illnesses that we find ourselves dealing with. So thank you again. please do get informed so you can do better for your health and your family's health. And also, just go on a journey with a community. You can join our community by going on to info and send us an email, and we'll come back to you with details and the location of how you can start doing your journey with us. And we have a partner of companies that are collaborating with us in giving you the best platforms to do your healthcare journey with us. So if you are not in a particular city, that doesn't stop us or stop you from accessing what we are enabled to help and serve you with. So join our community and let's do a healthy lifestyle together. Let's fight this pandemic and thrive after this pandemic as a community, as everyone who just wants a better South Africa in terms of health. We've seen what has happened in the past. We are losing family members due to sicknesses and pre existing conditions. We want to do a journey together. Let's start shedding some of this weight and this responsibility by making these better choices and informed choices for both ourselves now and into the future. So yeah, please get hold of us on 4irk.co.za and info at 4irk.co.za. On WhatsApp, we are on 072 569 7971. Thank you very much. It has been an honor. Looking forward to interacting and growing together and making healthy choices together. Thank you, guys. Bye.